Welcome, Dr. John Pavlakis. It's great to see you.
Hi, everybody. Thanks for having me.
And I will be referring to you as Dr. John. And why is that, Dr. John?
I think it's just a better feel for me, like as a practitioner. My last name is Pavlakis, so some people have trouble with that, especially like the little kids. So it's just a better flow in the practice, and it's what I prefer.
Okay, well, we're sticking with that, Dr. John. Let's go with our first question. Why do you think providing compassion in your dental practice matters?
Let's be honest, like no one enjoys going to the dentist. It's not a secret, but I'm the same way. Like it's just not enjoyable, but it's important. So anything we can do as like a team or a practice to get people in the office, make it as enjoyable as possible, educate them and improve their overall health, that's a huge win.
Providing compassionate healthcare can take more time. As you know, how do you manage this in a busy practice?
Mainly, we just set more time in the schedule. I mean, that's kind of a joke, but not really, because I did work at a dental office that was very production driven, time driven, and they dictated my schedule. And I couldn't do that. I just think it wasn't fair for anybody. So here we really just set aside a lot of time, especially with just the doctor and patient. And then if they need more time, we have them come back.
What's the average time then, since you actually spend more time than most dentists?
I think to start my exams, like when I was forced in time, it was 15 minutes for like a comprehensive exam. So I was like, the first time we're meeting, we're doing everything, and it's just not doable. So we like to start at least an hour. Um, and we go do like photos, x-rays, like education, take out like little dioramas, whatever we need. And if that's still not enough time, we just have them come back. Um, it's a lot of information to go over really fast. So I like to say, whatever you need, let me know. Every patient gets my cell phone number. If they think of something later, they just give me a call or text me. And I think that really helps.
Your patients must love you with
I
that
hope
kind of
so.
care. Dr. John, many patients feel that their provider is not compassionate. You were recently awarded the TPIU Compassionate Healthcare Provider Award for your compassionate healthcare. How did you become so compassionate?
I would just have to go way back. Like my dad owned his own dental practice, very old school. I always was there, whether I was working or just in the office, and then later on as a dentist. And I would see his first patients, they would start bringing their children and then grandchildren and just see that whole journey with them. It was amazing. I was lucky enough to see it like kind of flip. Like a lot of people learn dentistry and then hopefully compassion. But here, all I had in the beginning was compassion and that relationship and trust with patients. And then I learned the dentistry secondary. If you set your goals, I want to make the most money or see the most patients or whatever your goals are, that's what you'll be. So if you set your goals as I want to be a compassionate provider, everything else will work out.
Love that. Can you share a patient story with us that really underscores the importance of compassionate healthcare?
It is hard to pick just one because it's kind of like dentistry. Like if I do a big cosmetic case, I don't want anybody to know that those are fake teeth. I want everybody to know that those are just really awesome looking teeth. So it's kind of like a patient. Like I don't want that patient to just leave and I don't know, say stuff to everybody on the street and say, oh, he's the best ever. It's like, no, I just want it to feel natural. And that's it. You found your dentistry. Whenever you need help, you let me know. You come in and it just feels super natural. You know the whole team. You're so comfortable. I would say I do have a couple of patients because where my old practice was, they kind of would say like, oh, these patients are the ones that don't do anything, or they cancel appointments, or they don't care about their health. I'm like, there's no way. I'm like, just give them to me. I don't care. And a lot of those patients turned out to be my best, like most favorite patients. One guy I can think of like right now it was so cool because he wasn't the typical dental patient. He comes in, he's smoking and was always using chewing tobacco. And we go through all the, oral cancer screening. And I asked him, I said, hey, do you want to quit chewing tobacco. He's like, wow, I guess I do, but no doctor ever asked me that. They always said you have to quit. I was like, no. If you want to quit, we can make this work, but we have to know that you actually want to do it. And then instead of just telling him like go cold turkey or quitting, I asked him like, what do you like? And he likes to chew. So this was when like Zins were coming out. So I said like, let's get you on something that's less aggressive than chewing tobacco, just nicotine. And then we got him on a routine to taper down his dose. And I would check it with him like monthly. And then I came back with like 6 months later. And he's like, I'm down to like the lowest one, number one. And I got to tell you, I think you saved my marriage because my wife was about to kill me.
And you probably saved his life.
Yeah, I mean, it's cool. It's just like the little baby step. So I hope I did. I mean, I moved states, but I still talk to him and he's still doing really good. So that does make me feel good too.
Thank you, Dr. John. Lovely to talk with you, and continue on with your compassionate care.
Thank you.